And all day long on the radio, they've been playing
lots of the best music.
This is Eagle 99.3, your community radio station.
My name is Doug Baer. I am the Environmental and Health Preparedness Supervisor for the Dearborn County Health Department. To my left is Bill Black. He's the EMA Director. Johnny Lynn Stegemeller, our health nurse. And Stephanie Craig, she is with our hospital. So with that, I would like to open it up for questions that you may have. I have passed out consent forms that are both for children and for adults that we have made up. There's also what's called a VIS, which is a vaccine information sheet, which has got to be given out with every form that's out there. So I first want to know if there's any questions from the audience.
Do we have the vaccine?
Vaccine we cannot order until Friday, and that is the shot. The way the state is doing it at this present time, they're sending it out as an email. From the email, you will take it from that as far as your allocation number that you can order for that week. And every Thursday, I believe it is, that they're supposed to be sending it down on what your allocation number is. So our first orders cannot be placed until Friday. How much we can order, we really don't know. We also do not know the turnaround. So we could very well place an order on Friday and not see it till the following Friday. Or later, yeah. We just do not know the turnaround time on that. Have you heard any different?
I've heard. I don't know that it's true, but I've heard.
Yeah, about the same, yeah.
It's supposed to be middle of the week.
Well,
of the following week?
Yeah. We're going to play it, optimistic, that we're going to get it the following week afterwards.
Okay.
We cannot set up any times or any vaccinations until we have the vaccine in hand. With that said, there are target groups that we must address first. We cannot just open it up to the public. We've got to hit our target groups. CDC and the State Department of Health have set out the target groups as pregnant women, parents and caregivers of infants and those of under 6 months of age, children and adults from 6 months to 24 years of age, and individuals 25 to 64 who have underlying chronic conditions. We are working with our area pediatricians, our hospital, and people who are in the medical field to work with them to partner up with our department on that. When I say partner, we are allowed as far as a county to have 14 providers. Now when I say it's a provider, that means they're working with our department as that, and with us in the hospital, that's 12 other doctor's office or whatever that we can work with. Mm-hmm. So we are working with, we got about 4 or 5 that's already signed up for that, 5 that's signed up to be providers. So we cannot, everyone who wants to be a provider, we cannot sign them up. And one of the criteria for being a provider also is to be on what's called CHIRP's registry, which is Children Hoosiers Immunization Registry Program. Every vaccine that we give out or that is given out by one of our providers has got to be registered on that registry. And that's got to be done within 48 hours of that vaccination taking place. So, hope that answers some of those questions.
Yeah. Are the schools being used as far as administering the vaccines at all?
We're not using the schools as administrators. We are going with the schools, working with the schools, let's put it that way. But we are not handing vaccine over to the schools and say, here, you take care of it. Our job is to work with the schools in a cooperative effort to be least disruptive to the schools as possible. We have met with all the schools. The only school that we may not have met with, and I know we still have to do that, is Ivy Tech. Mm-hmm. They still have students there, which is probably a myriad of different ones in the county and other counties. But for the main school corporations being Lawrenceburg, some in Dearborn, and South Dearborn, we have met with every school, including the private schools within those corporations, to discuss how we can all work together to see this.
What sort of efforts are you doing in conjunction with the schools?
Well, with the schools, what we had looked at was that those school kids that are kindergarten through 6, we are going to set up afternoon through evening clinics. Most parents would want to be there and have, be with their child when that child is being immunized at that age. Plus, I don't think it's in the best interest of the school to have us out there with that school age group. Different counties may differ that way, but our stance is that we would want to give the parents the opportunity to be there with their students at that age. Now, when we go to 7 on up to 12, the plans are that we would go through the schools during school day to do that. And yes, they are one of our target groups, and so we have been working with them quite frequently. We are just now in the midst of contacting our daycare providers. There's a list of 17 that are on the state registry as daycare providers, and we've contacted 3. So we're working our way through them as well.
Okay.
But again, we are not planning on going to the daycare because of the school age. We are probably encouraging that we'll set up a clinic either here or some other location that would be convenient for the parents to be able to bring those age children in to us.
You're going to have evening hours, or you're going to be restricted to day hours?
We're working evening hours for this. You know, most people, just like what we are today, we're working during the day, and we're going to try to accommodate. That's the reason why when I talked about the schools earlier in that age group, it was immediately after school and till about 8 o'clock is what we're looking at.
How many cases have been confirmed in Dearborn County, or do they even keep track of that anymore?
I'm not at liberty to disclose that.
Okay. Can't just say how many cases. I mean, don't got to give names or anything, but.
I can't disclose that.
So we don't know how wide. You can't say how widespread it is.
So far, it's not really that widespread.
Okay.
Just a few.
All right.
The one thing that you got to keep in mind, they are not really testing H1N1 as much as they were in the initial stages.
Right.
Basically, the state stance is that if you come back with a A positive, that you're going to be treated as that, whether it was that or not.
Right. Okay. Now the state this week got the nasal vaccines. Dearborn County doesn't get any of those.
We have a certain allotment of them that we can order. And just as these fine ladies here have discussed, there's some issues with the nasal sprays that you have to be healthy adults or healthy
Age 2 to
2 to
49.
49. We really do not know all the medical history of everyone that would show up. We're leaving it up to the area doctors that may partner with us. And if they want to order it, then we can work with them under that. But as far as I believe our department in the hospital, we are going to be administering the shots. Most children that have come here have gotten shots in one form or another, so it's not unusual to do that. Realistically, the flu mist is not as prevalent. Let's put it that way. We're not going to get as much as that to take care of anything. Our initial vials of that are still low. So, just try and say that we would rely on that would be difficult.
So we're not going to have a shot clinic similar to the one you had last week per se. It's mainly focused on after school.
I'm not going to say that we aren't going to do that.
Eventually.
We have to hit our target groups first.
Okay.
Okay, and once we get through with our target groups, and that is a big task in itself, then we can, consider opening up a clinic for the general public, very similar to the one that we have for our seasonal flu clinic. But we aren't at that stage yet that we can think about that. We've got to talk about taking care of our target groups first.
As far as getting through the target groups, can you put a time frame on that? Just estimate how long it might take? Months, weeks?
That's going to get.
That
Depends
depends on how
how
much
we get and when we get it. I do not even want to start a school corporation without having enough vaccine to do the whole corporation. That is our county's plan.
You had a question back there?
Yeah.
Okay.
Do you have like percentages of the target groups that you're supposed to be hitting? Like, 90% of the school kids or,
There's not a target as